Dear students, welcome and thank you for tuning in to this video. I'm Dr. Lawai Al-Zobi and I am still continuing a series of videos from the medical instrumentation class that I'm teaching. I'm going to do the last video of lecture 16 in which I am talking about ventilators and respirators. I will be specifically talking about the modes of ventilation in this video. We talked about ventilators and respirators and inhalators in the previous videos, and we talked about all the cycles, so the flow, volume, time and pressure cycles, as well as a volume and pressure control modes for a medical ventilator or a respirator. Now I would like to go into the modes of ventilators. Most ventilators and respirators are classified as assistor-controllers and can be operated in any of three different modes. So we have something called assist mode, control mode, or assist control mode. And remember, we have described before the cycles and the controls, but now I would like to talk about the modes of ventilation, and that's the topic of this video. So what are those three different modes, and where do we use them, and why they are important? So the first thing I would like to explain is the assist mode. In the assist mode, inspiration is triggered by the patient himself or herself. There is a pressure sensor that is placed on the mask or the hose, and that pressure sensor actually responds to the slight negative pressure that occurs each time the patient attempts to inhale and intake gas. When that sensor senses the negative pressure, it knows that the patient trying to inhale, there was a circuit to trigger the apparatus or the ventilator or the respirator to begin inflating the lungs of the patient. The respirator helps the patient inspire when he wants to breathe. We need a sensitive adjustment actually to select the amount of the patient effort required to trigger the machine. So there is some adjustment and setup that need to be done by the biomedical engineer or the clinical engineer in the hospital in order to be able to use the ventilator or the respirator the way the healthcare providers want it to be used. So the assist mode is used actually for patients who are able to control their breathing but are unable to inhale a sufficient amount of air without assistant. And that's where we use ventilators with assist mode. We need to keep in mind that with this assist mode, we need to have a lot of other adjustments and control of the ventilator and the respirator, as we explained them in the previous video when we talk about time, pressure, volume, or flow cycles. The next mode of respiration is actually the control mode. And in the control mode, breathing is controlled by a timer set to provide the desired respiration rate. This mode is required for patients who are unable to breathe on their own. So this is different from the assist mode. And in this mode, the respirator has complete control over the patient's respiration and does not respond to any efforts by on the part of the patient. So this is a more automated mode of respiration that can be selected in the ventilator or the respirator, and this should be a decision by the healthcare provider. Each one of them, the assist mode and the control mode, has their advantages and disadvantages. To benefit from both of them, we created, or there is actually something called a mode that is assist control mode, which is a combination of the two. In this mode, the apparatus is normally triggered by the patient attempt to breathe as an assist mode. However, if the patient fails to breathe, which means that the sensor did not detect the amount of negative pressure that is needed to start the ventilation. So if the patient failed to breathe within a predetermined time, the timer automatically triggers the device to inflate the lungs. So there's a lot of adjustments and setup that need to be made for this mode, and this should be done by the healthcare provider or the end user, as well as by the clinical engineer. The patient control his or her own breathing as long as they can, but if he or she fails to do so, the machine is able to take over and help him or her breathe normally. I wanted to explain these three different assist modes of respiration. So we have so far covered actually the topic of respiratory therapy, and we talked about inhalators. We talked about the different cycles and control mechanisms or modes that can be selected, as well as the ventilation modes. Now, following this video and the third set of videos for ventilation, I will be actually talking about the other types of the respiratory therapy, which are the resuscitators, humidifiers, nebulizers, and aspirators. So I hope that you will join and watch those videos as well. Thank you for watching, and if you have any questions, don't hesitate to ask them in the comment section. I'll be more than happy to answer them for you. Thank you. Until next time. Bye.